More and more women are drinking alcohol. If you drink alcohol or are thinking of starting, it's important to be aware that alcohol does have risks, especially for your heart. In this video, you will learn about the risks of drinking alcohol, how alcohol affects your heart, and if you do drink, how you can reduce the harmful effects of alcohol. There's a popular belief that alcohol, especially red wine, is good for your heart. Some studies have reported that drinking a moderate amount of wine is linked to a lower risk of dying from heart disease. But these studies don't say that alcohol caused the risk to decrease. For example, it could be that people who drank red wine had a higher income, which according to research can mean less stress and greater access to healthier foods. So it could be the other factors that contributed to the lower risk. There is also research showing that moderate amounts of alcohol might slightly increase your HDL cholesterol, known as the good cholesterol. However, there are other ways to increase your HDL cholesterol levels, including exercise and eating foods such as fruits, vegetables, and grape juice. These foods provide your body with important nutrients, whereas alcohol, even in small amounts, is a source of excess calories with no nutritional value. There is also a lot of research showing how drinking too much alcohol can damage your heart. Heavy drinking, defined as more than 7 drinks each week for women, or more than 3 drinks on any day, is linked to a number of poor health outcomes, including heart disease. Drinking too much alcohol can lead to high blood pressure, heart failure, stroke, and issues with the blood vessels in your brain that affect your thinking and memory. Heavy drinking can also lead to cardiomyopathy, a disease of the heart muscle. Recent research has also shown that while drinking, people often have abnormal heart rhythms, which are associated with atrial fibrillation. Over time, atrial fibrillation can develop into a serious heart condition. Alcohol also negatively affects your sleep. While some people might find it easier to fall asleep after drinking, alcohol leads you to wake up several hours later, often having to pee. Your sleep cycle may also change, and any sleep you get doesn't restore your body as well. Poor quality sleep is harmful to your heart, and you may feel less motivated the next day to follow your heart-healthy behaviors, such as exercise and eating well. Research shows that the number of women who are drinking alcohol and misusing alcohol is increasing. While alcohol misuse by anyone presents serious public health concerns, women who drink have a higher risk of certain alcohol-related problems compared to men. Women are more likely to get alcohol-related heart disease than men, even though they may drink less alcohol over their lifetime than men. It is becoming more common for women to use alcohol to cope with the stresses of managing their responsibilities, such as work and caregiving, while running a household. If you notice that you are craving a drink to cope with a situation, talk to your healthcare team to help find support. For women, there is a small difference between how much alcohol they can drink safely and how much will cause health problems. Some experts believe that women who drink even more than 1 alcoholic drink a month may be putting themselves at increased risk for health problems. Moderate drinking for women is defined as no more than 7 drinks a week and no more than 1 to 2 on any given day. But the amount of alcohol a woman can safely drink depends on many factors, including weight and health, genes and family history, how much time has passed since eating, and age. As you age, it is harder for your body to process alcohol. You may feel the effects of alcohol sooner, so you may want to have fewer drinks. If you drink alcohol, you may want to consider drinking less, and there are many ways you can get started. Choose a lower alcohol drink. Add ice cubes or club soda to a drink to dilute it. Try alternating an alcoholic drink with a non-alcoholic one. Or try non-alcoholic beer, wine, or cocktails. In summary, don't start drinking alcohol if you don't drink already. And if you do drink alcohol, have only 1 or 2 glasses in a day, preferably with food. Try not to have more than 1 drink an hour, so your body has a chance to process the alcohol. Plan a few drink-free days each week. Try drinking less over time. If you are concerned about your drinking, talk to your healthcare team. For some people, talk therapy can help. There are also several medicines to help people drink less or stop drinking if they need to or want to. Using talk therapy and medicine together can be very helpful for those who are drinking too much. Know that help is available.